Welcome to The Movement, a podcast from the YMCA of Greater Kansas City. Here we share real stories of how our community connects through youth and family development, healthy living programs, and social responsibility campaigns. Our goal is to connect the Kansas City community to the people and stories shaping and building a stronger and better future. From early learning to teen leadership, from senior support to neighbors helping neighbors, this is where Kansas City comes together. You're listening to The Movement, the why, where Kansas City connects.
Welcome to The Movement. I'm your host, Mark Hulet. Today we're talking about what happens when healthcare moves closer to real life, closer to families, closer to children, and closer to trusted community spaces. At the YMCA Healthy Kids Day back in April, KC Care Health Center brought a mobile unit directly to the YMCA, the North Kansas City YMCA, offering dental checks and wellness screenings for families who were already there to connect, play, and have some fun. And a little bit of learning, too, on that day. That moment captured something powerful. Whole person health does not start only in the exam room. It starts where people feel welcome, known, and supported. I'm joined today by Will Franklin, President and CEO of KC Care Health Center, and Doug Day, Chief Marketing and Development Officer at KC Care. KC Care has served Kansas City since 1971, and today provides unconditional whole person care that people across our community, especially those who face barriers to accessing care, can access care. So, Will, Doug, welcome to The Movement.
Thank you.
Thanks, Mark.
Well, we're going to get right into this. Well, let's just start with you. So, for someone who has driven past KC Care, a location, or heard about it, heard the name, but may not know the full story, who is KC Care and who do you serve?
Sure. So, KC Care Health Center is known across the United States as a model of care called the Community Health Center. Some people use the word federally qualified health center. That's really a federal government term we use, but we think of ourselves as a community health movement that actually originated not long after the Civil Rights era. And the whole concept was born actually out of Lyndon Johnson's War on Poverty. So we are as much a healthcare institution as we are an economic development institution, in the sense that I think of us as we're a safety net healthcare provider, but really we're healthcare infrastructure, much like roads, highways, streetlights, things like that, because if everyone in a community doesn't have access to care, it impacts everyone in different ways. And so I think of the work we do as we are really an economic engine for the communities we serve. We bring jobs to the community. We hire from the community that we serve. And you hit the nail on the head when you said that healthcare is about much more than what's in the exam room.
Yeah.
Reality is that we're meeting our patients where they are. So we provide things like healthcare services for medical, dental, behavioral health, pharmacy. We've one of the largest HIV care providers in the state of Missouri. We bring care coordination services, insurance navigation, a whole suite of things together for communities that need the most. Families, older adults, young people, across the board. But you mentioned our mobile medical units. That's a component of what we do. But really, we're here to provide access for people no matter what their ability to pay is. So I think of all of those things we do as tools, but at the end of the day, we're really trying to help move people out of poverty and into economic stability. Healthcare just happens to be the tools that we use every day to do that.
And Doug, following up on that question a little bit, when you think about the people who walk through the doors, what are some real life barriers that they may already be carrying before they even get to that point?
My goodness, the real life barriers are our patients face. The list is a long one. And I think many of your listeners will probably, add to the ones I would mention. But I think, housing stability. I would think for sure one of the barriers is they don't have medical insurance. That's obviously economic burden. 70+% of all of our patients live at or below the federal poverty level. And so, you just put those two or three together and the problems begin to compound pretty quickly. And we see that. So that's our sweet spot. That's why organizations like KC Care exist, because that population of people has been with us for a long time. And it's our privilege and our joy to help people that have strengths and are resilient people and are strong people and have potential abounding in their lives. It's our gift to the community to help those folks into their next thing.
So just going back, I want to go back to Will here and talk about this federally qualified health center, the FQHC. And again, it's thrown out there, and sometimes people start thinking about federal, and where's the red tape and all the things happen. So I opened up with it's different than your typical path to a doctor's office or a clinic. So what is the difference?
Absolutely. So federally qualified health center, there's really, if I were to print it out, it's about a binder thick of regulatory frameworks.
Shocker.
Right? But brass tacks, at the end of the day, it means a couple of things. One, it means that we provide care regardless of your ability to pay, and we offer a sliding fee discount. So the fee for anything that you might pay for care is really related to your household income and how many people live in your household. So it's a sliding fee scale. Secondly, major requirement is that we have a board that more than 51% are actually patients of the services we provide. So it's kind of at the heart of the movement is patient-centered care. Another big piece of that is by that federal qualification, it means we're able to purchase drugs through what's called a 340B program. It's a federal program which we purchase drugs from our pharmacy, and we're able to offer those drugs at a sliding fee discount as well. So for a lot of folks, it's diabetes, hypertension, those medications that can be life-saving or even preventative type of drugs for folks. We offer those at a lower rate of cost. I think the other thing that makes it much different is with the ability to do that and the ability to have some federal funding. The federal funding we get does not even cover 20% of the cost, actually. But what it does do is bring a whole host of regulatory quality metrics to the table. So we jump through a lot of hoops in terms of compliance, in terms of quality of care, cost effectiveness. I've seen data where every $1 invested in a community health center, the return is like 4 to 5.
Nice.
In terms of cost effectiveness. So high quality, low cost, low barrier to care.
If I could just piggyback on that, I think one of the things that, just in case we have listeners that have no idea what a community health center is, it's all of that. I think the things that I think we often assume is that we have multiple medical services consolidated under one roof. Medical practices now are privatized, and you go one place to get your dental care, another place to get your primary care. For our patients, it's all under one roof. So that's one of the ways that we increase access to care is that they don't have to go to multiple places. They can go to one place in their community and have a primary care doc, have a behavioral health, therapist, have their pharmacy, have their, their dentist, all in the same building.
I find so many parallels here between what you're saying and the word you're saying and the YMCA. And
true.
You started with the sliding fee scale. I mean, we're in the community and we're offering financial assistance, based on those same types of qualifications in the community and how we do that. And then, you end up working down the path of how people have access and, being this, again, we continue to talk about being the center of community, but working with the population from this age to that age and all the things under one roof, youth development, healthy living, social responsibility. Exactly. So I think there's so many parallels about this conversation. So Doug, back to you. Sure. On just to follow up on, we kind of talked about the unconditional whole person care, and it's in quotes as I look at my script here, but how do you communicate care in a way that reduces fear, stigma, and the feeling that this place may be not for me?
Communicating care is it's an intangible thing. How do you communicate care? But one of the fundamental signs of just a caring person, Mark, is that you anticipate the needs of someone else. And the same thing is true for an organization. And KC Care anticipates the needs of our patients a number of different ways. One of the ways that we do that is through a specific staff position, a team of people that we call patient health coordinators. And that team works alongside our medical providers to anticipate all the non-medical needs. We like to shy away from saying staff is clinical or non-clinical because we work in a clinical environment. But this group of people brings a very special set of skills to help anticipate needs that a number of our patients might have based on the barriers we mentioned earlier. So they would do things like help them apply for public benefits, help them access resources like food or housing or other resources, help them navigate the healthcare system itself. So, they're critical glue to help our patients stay on a healthcare path toward a healthy life.
Yeah, that's fantastic. And I go back to this word unconditional because I've heard it. People can come and not worry about whether they have any type of insurance or any type of support that way. It's unconditional. The conditions are off, correct?
Correct.
If you walk around at any of our locations, so we serve about a little over 23,000 patients across 3 clinical locations in the area. You could stop by any one of them, and I guarantee you're going to run into at least 3 or 4 people who are wearing a KC Care t-shirt that says "Everyone Belongs."
Love it.
It's like the favorite t-shirt that we have from a staff standpoint. But that's the truth of it, is everyone belongs. Everyone is important, and we try to meet people where they are, and there's no judgment walking in, no matter what you're walking in for.
Let's go back to Healthy Kids Day. And from the YMCA's perspective, having healthcare services coming on site where families and kids already are going to be was powerful. It was powerful. It removed barriers like we've talked about. It brought the service to the people. It built trust. It showed what it can look like when that whole person health and healthy living come together in a community setting. So, you brought the mobile units, and roughly 2,000 families are there, and kids are participating, families are participating in the day. Walk us through, and because I know, Doug, you were there that day.
Yeah.
Walk us through how that came together and what you saw there.
Sure. Well, how it came together is, as so many great things do, it came together over a conversation over coffee. And so I was meeting with
probably not decaf.
Yeah, it wasn't. None of mine are, but no, I was having a coffee with your senior VP of branding, Paige Salveter, and we're college chums. And what are you doing? What am I doing? And hey, we should think this together. You're in health. I'm in health. Is there a thing? And she's like, I've got this great event. Could you think about doing it? And so it just started with the what if, and do you want to play together? Do you want to, get an organization together? And so we said, heck yeah. And so KC Care was really thrilled to rally some great people from our staff. We've got 2 really effective mobile units that we love to utilize. They're tremendous assets for outreach in the community. And so we had dentists there, we had primary care docs there, we had patient health coordinators there. Yeah. And so it was dental screenings, it was health check-ins, it was health information, lots of conversation just to begin having dialogue with just everyday folk and their kids about their health. And of course we had, that's an access to care point for us. So for sure we had, wireless tech there that helped schedule appointments and get people in our system if they wanted that. But I think what we saw again and again throughout the hours that were there, and it turned out to be a gorgeous day, by the way.
It was pretty that day.
It was cold early. It was really cold early, but it warmed up. But what we saw is so many families and so many individuals that genuinely cared about each other. My guess is that the YMCA creates that kind of caring vibe and draws people that are like that to their spaces. But they also, the questions we receive from those families were really pointed. Not only did they care about each other, but they really genuinely cared about their health and the health of other people in their family, where they were talking about, maybe they were there with an aging parent, or maybe they were there with a child. And so very interested in finding good resources, available resources for their overall health.
Did you feel like that day revealed anything about unmet needs in that community?
You know, most of the conversations that we had with people it's interesting, healthy people already know where the doctors are. And usually they know where the YMCAs or where the gym is. So we didn't, come up with too many people that were like,
Right.
in desperate need of healthcare. Some hadn't seen a doctor in a minute,
Yeah.
but we didn't see a whole lot of those real urgent cases, which was great.
And go back to my comment earlier that it seems like there's this natural connection between Casey Care and the YMCA and bringing care, clinical expertise, why being a trusted community space, prevention movement, youth development, family connect, all that stuff. But here's the question, and I'll go to you, Will. There's a phrase: preventative health plus active lifestyle it's not a secret sauce anymore, right? I mean, those things together serve up a longer, better life.
Yeah, they do.
Period. Where do prevention and primary care and active living intersect, in your opinion?
Well, I think that the variables that impact overall healthcare, a lot of them have nothing to do with the healthcare services themselves, right? I think there's so many preventative things. What happens and the habits developed even in a situation where mom is pregnant, how she cares for herself during pregnancy impacts the child. As that kid's growing up, things like vaccinations, right? Healthy teeth, nutrition, all the variables that we think of sometimes, those really don't have anything to do with the healthcare system at large, right? Those have to do with prevention, have to do with public health, access to services, access to healthy food, the ability to live in a neighborhood where they can walk around, play, do those things. And so we recognize that there are a lot of people call the social determinants of health, right?
Yes.
Many of those things are kind of systemic barriers sometimes. And so we feel like it's really important as a place where we intersect, I think similar to the YMCA, in that we're trying to impact those things at a larger level, whether that's policy, whether it's through meeting people where they are, improving economic stability, or maybe even putting a health center that's bringing economic resources to a neighborhood that we serve. I think all of those variables intersect with prevention in the sense that the healthier the community is, the more vibrant the community is, the more diverse the economics are, the neighborhood or a community, the more successful they'll be down the road.
Doug, how do you see healthcare and community-based wellness reinforcing each other?
Well, they certainly do. And I think it's one of those things I think everyone knows. Like if I go to my doctor and he says, hey, here's some medicine, take the medicine. And also if you got a solid 8 hours of sleep and maybe moved your body, you're going to get health. I think it's those kinds of things. It's like doing this, like drinking enough water, all the programs and education that I'm sure the community receives from programs at the YMCA, those lessons applied with a consistent routine of seeing your preventative care doc, the health outcomes for that population are going to soar well beyond anybody else that doesn't do that. That's a generalization, but I think I'm pretty right with that generalization. So I think that's the case. So all of our primary care docs are going to encourage lifestyle changes, whether it's nutrition or physical activity or mental health or just different things to.
So the events like we were talking about earlier, I think are super important because no one organization or no one kind of part of the ecosystem can address those things alone. There's a piece that's important for us to do as healthcare providers, but the reality is we need partners in the community. There are current challenges with public health, Medicaid funding, workforce shortages, all kinds of things out there. Political winds blow different directions every few years. Our job is to constantly focus on our patients' needs, no matter what those externalities are. But we can't do that alone. We have to have effective community partnerships to make that work for everybody.
Yeah, that was going to be my follow-up question to you is with the partnership and what KC Care is doing with the Y, what would it be harder to do by itself than together? How do we do 1 + 1 is 3?
Absolutely. I mean, I think that's for us as an organization, the reality is resources are diminishing, no doubt. Complexity is increasing. The needs that our patients are telling us they have are growing in complexity as well. So the reality is we have to get good at partnering because we can't address all of those things effectively on our own. And I mentioned earlier, I look at this as healthcare infrastructure, right? You need public health, you need water, sewers, everything for a city to work. I think in much the same way that our healthcare ecosystem is too. All of the parts are really important, and it's more important than ever that those parts are connected and engaging, because the reality is reducing cost of healthcare in the United States and increasing health outcomes. It's not rocket science, but it does take collaboration, cooperation, and effective resource management.
At the Y, we serve people across all stages of life, from young children to older adults. We're literally serving, 6 generations. You are too, right?
Yeah, for sure.
We feel our programs create community. We feel like we are a connector in the community because of the people that we serve. And we do 10,000 programs, but we do one thing, and that's connect community. And so we're a connector. Creating touch points, families, teens, kids, youth. You've said it. I mean, it's the same bucket of people that we're serving. So across this spectrum of all those people, from age 0 to, I love talking about Miss Bird, who's 108, who gets in the pool 3 times a week at the Cleaver Y. And she looks 80 and she looks stunningly sharp, and she's quick-witted. Where do you see the greatest opportunity together to make an impact? And maybe just pick a couple of stages of life where you see enough about us. And again, just brainstorming here live, right? Mm-hmm. Just having those conversations about how you can see that and what works and what you feel, whether it's bringing the mobile units or let's just do some brainstorming live.
I'd love to hear you talk about maternal health.
I was going to say,
is that where you're going to go?
That was where I was going to go. Yeah. To me, I think that's a huge priority in my mind, because if we don't improve maternal health and infant mortality rates in the state of Missouri and in the Kansas City region, I think it's harder to get to the other outcomes that we care about.
And birth rates are on a decline already anyway.
Right. And so I think if that's the first place in my mind, a healthy start. And prevention is a whole lot more fun and I think easier when it's done in partnership than sometimes intervention after something has already gone wrong or there's already chronic health issues that you're managing, because then it's a lot of coordinated interventions.
Seems like that story is so true, working upstream instead of downstream all the time, right? It doesn't matter what that might be, whether it's health disparities or health or crime. I mean, again, there's so many factors. Getting to the issues as early as you can is truly the answer.
Absolutely. Because, those first 3 years of school for that kid, right? Their experience of school in those first 3 years can shape their entire academic future, right? So engaging early to make sure that they've got their vaccinations, right? They're not going to school with dental pain, early access to behavioral health interventions. I think all of those things are critical to a good education and to a healthy lifestyle along the road. So, I mean, if we're going to talk about where's the most impact or opportunity right now, let's say there to start with, there's lots of places.
Yeah. Doug, any thoughts?
I think that's the best place to start, at the beginning of life. I think one of the things I said earlier, I made a generalized statement, which I'm great at doing, is most of the people that I think would be involved with Y already have probably a medical provider, but some of them don't.
Oh,
I'd love for you to push back on that and say I'd be wrong.
I wouldn't say that. I wouldn't even want to guess at a percentage. But again, we see those same people that are bringing in, their pay stubs and their salary information to apply for financial assistance scholarships. So I mean, there is a percentage of that that's pretty significant. I'd say at least 20 to 25% of people are in that barrier. How can we help financially assist them?
So I think in that 20 to 25% is where the opportunity lies for us. And I think ongoing conversation would be helpful. I think one of the opportunities, I almost said pointed opportunities, but I think it's with childhood immunizations. Whether it's for summer camps or sports physicals or those kinds of things that parents want to provide opportunities at the Y, but that type of medical screening is a requirement, is necessary for the Y to do what they do and have consents for them. I think having a partnership like that where we facilitate enrollment into your programs to give them access to everything that you have, but that there is that point of intersection where not only can we maybe be on site or however the referral process works, but they're introduced not only to us for the point of care that they need, but then they open the door to all the other resources that we provide at our locations around town.
Yeah, I put you guys on the spot and you guys nailed it. I love it. I love that.
Oh,
you mentioned behavioral health, and again, it's in our strategic plan. How do we continue to provide access or support for not only for the people that are members and our program participants, but for our staff, right? I mean, this is a whole world problem here. Sure. And so I'd love to hear you talk a little bit about behavioral health services, if that.
Sure. And that's where I started my career. I'm a behavioral health clinician that stumbled into healthcare administration at some point in my career and it stuck. But I spent early part of my career in healthcare safety net working in behavioral health with kids and families. And I think that access to early intervention is critical. And it's not just about managing behavioral health, but it's also the behavioral health of parents, right? We have parents who are very stressed. When I think about parents who are in between jobs or who are working multiple part-time jobs because a lot of places don't hire full-time workers, right? So they're navigating a lot of those challenges, access to childcare. All of those things create a significant amount of stress and friction that people encounter. And I would say even sometimes just the act of filling out forms for financial assistance can be a form of friction that parents just get almost to the point where like, well, I'd just rather not deal with it, right? So, I think a big challenge, and I think it is behavioral in nature, is that the amount of stress and friction that people experience are a big factor in the choices they make in terms of the healthcare for themselves and their family. So if I'm making strategic choices, and I get frustrated sometimes when I hear whether it's healthcare entities or things like that talk about folks who are non-compliant. Well, a lot of times those are strategic choices that people make to purchase medications or pay rent or pay for groceries that are a lot more expensive right now. And so I think it's really important that we acknowledge the behavioral health impact of that chronic and ongoing stress. And that's where I think social connection, finding a sense of universality with people, recognizing I'm not alone in what I'm doing and facing, and that alone can be a significant intervention or preventative tool. And so I think opportunities where KC Care organizations like us and the YMCA, we're all focused on, you said connection.
Healthier lifestyles and connection.
I think that's a critical piece of it. And I think can impact behavioral health, not just, that's cross generations, right? People kind of carry that kind of trauma with them over time. So I think it's a huge component part of what we're doing.
Kansas City has some real health disparities. Most metropolitan cities probably do. And we know things like zip code. You just can't vary it down to zip code, but you can look at zip code.
Sure can.
Income, transportation, access to insurance, language barriers. We have that. We have the most unique, diverse population in the North Kansas City community with the number of immigrants that are in that population. Language is a barrier. And just trust and social connection that shape those outcomes. Can you dive a little bit deeper on how Casey Care is trying to break the cycle to reduce those barriers? If you want to get down to tactics, I mean, there's some really unique things that you guys have put in place to help do that. I mean, communication partnerships, you've mentioned several of those, but is there something that you guys just say, man, this is really a really unique way that we're trying to reduce barriers in Kansas City?
I may be too close to it. We currently, I mean, one of the things that we try to do is, so transportation is huge for our patients. And so we strategically position, this is not where I'm going with, but we, right on the bus lines, every one of our locations is around the bus lines. But the bus takes time, and sometimes you have to take several. And so we've got a program now, maybe where you can fill in the blanks on the transportation services that we provide our patients outside of public transportation. Because, the fees for the buses started in just a couple weeks ago, right? And so that's going to be an added barrier to some of our patients. And so we recognize that. And so transportation is one of the biggest barriers that we face. And so we put together and sort of beta tested several transportation programs in the past, but can you give us some more detail on that? Because I'm not close to it.
We provide a lot of rides for our patients in terms of it's kind of like white label Lyft or Uber programs.
Yeah, ride shares things.
Ride share programs that allow people to get to their appointments, right? I mean, that's a big piece of it. I think the other thing that we think about a lot is sometimes it's not a matter of, a same day or next day visit, but it's a visit that's convenient. And it's at 4:00 on Thursdays when I have childcare and I'm not at the extra shift, right?
Just doesn't fit the schedule.
Right. Mm-hmm. And so we're trying to be really thoughtful a lot about our scheduling practices, our hours of operation, having some evening appointments available. And then we do have all day walk-ins available. We know that sometimes most people, I mean, when I'm sick, I didn't plan it. I'm not feeling well. And so I think that doing things that kind of meet our patients where they are, like recognizing, what we need to have walk-ins available all day, every day. That's an important piece of what we do. You mentioned language. For a long time in the Kansas City region, people going through legal channels of immigration and coming into the Kansas City as a refugee, the credentials that a physician have to basically help clear everybody through that process, complete their paperwork. It was only like 6 people available to do that work. And if the work doesn't happen within a certain amount of time, it really makes going through all the hoops of immigration difficult. We have our chief medical officer on staff, Dr. Craig Dietz, who has that certification. We try to make that process as super transparent as possible. It's very clear. There's no cash prices. Not only that, but we're not just offering that service to get you through immigration. We're becoming your doctor, right? And a care provider. And I think that back to your point of that you can only move at the speed of trust. I think that's critical. I think building trust in spaces where people often encounter no, and being able to say yes, and not just yes for now, but yes no matter what, I think is critical to overall healthcare outcomes.
We continue to look for ways for the community to understand how you can access your services, our services, without the misconceptions. And I'm assuming there's misconceptions of what Casey Care is in the community. What are some of those that you can help disprove?
Yeah, I think I hear sometimes people say, "Oh, well, I don't want to go there because I'm going to be taking a spot." That's for people who don't have any means, but that's not true. Actually, we serve a lot of patients. Everyone from, we have Harvard-trained physicians here, right? We're offering a standard of quality that I think is highly competitive, right? The reality is it's not for someone else. It's for you, no matter who you are. And so I think that's a message that we try to yell from the rooftops, right? Is that, yes, a lot of our patients are working parents. They're construction workers. They're, fast food, all kinds of different industry. But there's no definition of who people need to be. You're not taking up a slot, right? Actually, you're helping to increase access, right? In our minds, in a world where Medicaid funding, all of those things are challenges that we're managing, our mindset is that we create an environment where quality of care is really high, trust is high, and there is demand. We can figure out a way to braid funding, create reimbursement structures, challenge the system where we need to, and make possibilities happen.
Any follow-up on that, Doug?
Yeah, I think the other one that we see a lot, even with our own patients, is they, for whatever reason, they don't see us as their primary care doc. They see us as going to the doctor when they need like like I've got a rash or I'm not feeling well.
Emergency room care.
Emergency room care,
Yeah.
right? And so that's a misperception. I mean, we exist to have our docs have patient panels, just like any other medical provider. We have patients assigned to certain doctors to be their primary care physician over the life of that patient. And so we want history with our patients. We're designed as an organization to maintain a continuity of care, not just in one service line, but multiple service lines integrated in our health services, in our health record, electronic health record. That's all there. And so that's the thing that we keep hearing. We just do our best to message out to our patients. This is your primary care doc. Come see him for everything. Come see her for everything that you might need.
Sometimes that message of prevention is difficult because, I don't want to go see the doctor if I'm not sick in the moment. And I totally get that. But I think that's where we've really got to kind of get the message out there that actually it's good to come see us when you're not sick, because that's when we can get those preventative things done and those screenings done to actually keep you from getting sick down the road.
You both are great storytellers, and I love this. So Doug, it's a little bit in your title. In the CEO title, you're always telling
stories.
He's a
great
storyteller.
Yes,
Don't let him but from that storytelling perspective, Doug, I'm going to ask you this one.
Sure.
What does success look like if a partnership between the YMCA and KC Care? It's both of you. However you guys want to answer that.
I think the end result of what we're about at KC Care and at the YMCA is we're about healthy communities. I think that's the big vision is, you get a bunch of dreamers in the room that understand, healthy lifestyle choices and have skills and resources to do that. You get people in the room that understand really the technicalities and the expertise of clinical care. And you build bridges between those organizations and processes of communications and referrals and actual friendships and people that know each other. And you get people in that kind of community and it compounds on itself. So that's, if we're going to pull out the big dream, I think that's the big dream for me, for us.
At the end of the day, I think relationships matter to our patients. And I think that matters from an organizational level as well. I think that when I think of outcomes, I think there's some process outcomes you could look at. But I think at the end of the day, if you're impacting overall health outcomes through the relationships that are built, and Doug's point, when those become systemized too and routinized. And so when somebody at KC Care can be like, hey, have you talked to Larry at that YMCA over there? I think that matters. That warm handoff, knowing the name, understanding what the needs are, it speaks volume.
I want to kind of end with this idea. The future of healthcare is not only in clinics. We've talked about that, right? It's also in trusted community spaces where people already gather. And when Casey Care and the YMCA come together, we're saying that health is bigger than that doctor's appointment, right? It's a movement. It's prevention. It's access. It's dignity. It's connection. It's belonging. You used that word belonging early on. So to both of you, just a question. What would a truly connected Kansas City health ecosystem look like?
Well, it'd be a beautiful thing. I mean, that's taking the dream to the next level, Mark. That's the whoa, Nelly question.
Yeah, I know.
You know, I think you begin to see health disparities if the ecosystem begins to really function.
It changes everything.
I think you begin to see health disparities crumble before our eyes.
Yeah.
Yeah, that's historic level stuff.
Yeah. But I mean, I think about all the nonprofits, and there's a consortium of nonprofits that got together to try to focus on, workforce development in the Kansas City metro. But there's other things too, But how do you pull in the schools? How do you pull in the healthcare centers, the hospitals, the cities, the government entities? I mean, you guys are already playing in the federal. We've played in the federal with, Head Start in the past and understand the level of demand and compliance that comes along with that. So what's one thing families can do this month that are listening to take a small step towards better health?
I think call your doctor. I think earlier this week it was actually National Call Your Doctor Day. Right?
Missed that.
And so I think that understanding kind of what screenings you might be due for, right? Yes, it's June, but school starts. It's going to be here before we know it. And so getting those back to school physicals done before everybody's calling to get it done at the last minute, I think those things are important. And I think getting your dental checkup too. I think that song we all learned when we were a kid of the head bone, neck bone. It's true, right? It's all connected. And so oral health really impacts your overall healthcare significantly. So I think coming in for those preventative cleanings and visits are really important. I'm still thinking about your other question though. Yeah. Right. And that's,
I didn't give you a chance on that one.
Yeah, I know. And you're probably like, yeah, we didn't want you to answer that one.
No, I do. Absolutely. Circle back.
I've got a lot of soapboxes to jump on. And I think sometimes I feel like words like health equity are thrown around a lot, but there's systemic inequity that I think it's an opportunity to tackle through collaboration, almost like 1% at a time. When I think about the fact that big healthcare systems are often merging, pulling together. They're not doing that because it's an improvement in value to patient care, or that they're going to be able to offer something better than they did before. They're doing that for contractual leverage for reimbursement. And I think at the end of the day, if we can make some headway as a region sometimes on how do we get past this notion of contractual leverage with the insurance industry. So there's equity in payment, right, and reimbursement, whether you're an FQHC, whether you're a small doc in a rural area or a hospital. I think that there's real opportunity to make significant headway in that regard. And so I offer that up as a little bit of a challenge.
That's that's the CEO stirring the pot right there. It's pretty great.
I think it's an opportunity through collaboration, though, that could have some significant, meaningful impact. And I think about we're trying to bring low-cost healthcare solutions to communities and to hardworking families who need it at the end of the day. And I think that's not a proposition. I think it would take a lot of, I don't know who would say I'm not behind that. And so I think there's opportunity there.
I always, how do I want to say this one? I believe sometimes hope starts before trust. And, what gives you hope about the future of health in Kansas City?
Well, right as I took my first healthcare CEO job 7 years ago here at Casey Care, about 6 months into that, I used to think long-term planning was the way to go, strategy. But this thing called COVID-19 pandemic hit.
Remember it well.
And I think one of the lessons, though, and I think back, and not that I want to romanticize a pandemic, right? I'm not doing that. But what I loved is that all the rules went out the window. And when we threw the rules out of the window and we just focused on providing care and doing what really mattered to patients, stuff that we thought could not be possible became possible overnight. When Congress released CMS regulatory frameworks on things and we could just do what patients needed, that was amazing, right? And so the reality is I look back at really hard times and how people responded. So yeah, there's some key challenges right now that we're dealing with, but I think going through that really changed my mindset in terms of what possibility is. And back to your point of hope, I think there is hope in the sense because I've seen really hard times and I've seen how when we work together, when we share the same priorities, and when we let go of how things have always been done, it's amazing what can happen.
I truly believe that hope brings possibility.
Absolutely.
Right? Whole person health, active living, unconditional care, they're not separate ideas. They're connected parts of a healthier Kansas City. When we show care, when it shows up in trusted places, when families feel welcome, when organizations work together instead of working alone, and we remove these barriers and create real opportunity for people to live healthier, more connected lives. Well, Doug, thanks for your leadership and for being part of the movement today.
Thank you.
Thank you.
If this conversation moved you, share it with someone who cares about Kansas City and take that one small step this week for your own health or for someone else's. I'm Mark Hulet. This is The Movement, the Kansas City Why, the why where Kansas City connects. Stay motivated, stay connected, and keep moving forward with us in the movement. Together, we're building a stronger, more connected community, one story at a time.
Thank you for joining us on The Movement. If today's conversation inspired you, connect with your local YMCA and explore all the ways you can get involved in your community. Together, we're building stronger families, healthier lives, and a more connected Kansas City. The Why, where Kansas City connects. Thank you for listening to The Movement.